My name is Dr. Tejaswini Trivedi, and today we'll talk a little bit about melasma. So, what is melasma? Melasma is a condition which is where a patient presents to you with hyperpigmented. Hyperpigmented meaning darker than your normal skin. Hyperpigmented patches over the sun exposed areas of the face. Now, you might wonder, why does this happen? It happens because of three reasons. So, firstly, it happens obviously because of UV exposure, and secondly, it happens because of heat, and third is because of hormones. Hormonal imbalances a lot of times cause melasma. This is why you will see a lot of times patients post pregnancy having these hyperpigmented patches over the face. And do not confuse them with SLE. This is why it is very important whenever you just see one symptom, not directly to come to a diagnosis. We have to always look at the clinical picture and all the other symptoms, and only then come to a single diagnosis. Never just see one symptom and directly think of a diagnosis. So these are the three reasons why melasma happens. Also, now a disclaimer, which is that never treat a patient of melasma with lasers. Why? You might wonder. One might say is because when you treat a patient directly with lasers, it just makes the whole condition so much worse. So then why would you want that, right? Instead, how do we ideally treat a patient of melasma? Let's look at the three ways in which we would treat the patient. Firstly, you have to remember that when you prescribe a skincare regimen to the patient, to keep the skincare regimen very simple, meaning just a few steps, not these 17 18 different steps, which is not sustainable, right? If somebody has to do 17 18 steps on a daily basis, they would probably do it for a few days and then not follow through. So make sure that the skincare regimen is small and very less steps are there. First thing, we will incorporate vitamin C into the patient's regimen, and while prescribing, make sure that the packaging of the vitamin C is uh, darker, it is opaque, so that the UV rays, and it's a vitamin C is such a molecule which becomes very unstable. So make sure that the packaging is opaque. Secondly, you have to also incorporate sunscreen. Repeat after me: sunscreen into the patient's regimen. Why? Is because whenever you prescribe sunscreen, and no matter how wonderfully you might treat the patient of melasma, and no matter how great you are at the treatment, it is going to reoccur. Just like a lot of medical condition, melasma is such a condition. If sunscreen is not used, it is going to reoccur, and that's why sunscreen is very important. And after the second thing, let's look at the third one. The third thing is retinol. You must have heard this term a lot of times in on social media, or a lot of times you must have heard that use retinol or tretinoin for anti-aging, etc. Why do we give retinol to the patient? Is because retinol increases the skin turnover, and by doing so, makes the whole process so much faster than how the skin would normally react and how skin normally functions. This just makes the whole cycle so much faster. That's why retinol is wonderful for melasma. And make sure you tell the patient to use retinol only at night time or during the evenings, so never during the day. And that is all that I had to that was my take on melasma, and thank you. Goodbye.